did a test for Lyme disease. What is the proper test today to be done?
Let me talk about the two tests. The ELISA test is a mixed antibody test. It mixes early antibodies and late antibodies. The Western blot also separates into immunoglobulin M, which is early antibodies, and immunoglobulin G, which is later antibodies.
Which is more accurate?
The Western blot is a more accurate test.
There's numbers, and look at these numbers. Any particular number that you would be more concerned about, a different number?
Well, in the Western blot, there are particular bands that are specific only to this Lyme spirochete infection and to no other infections in the world. For example, in the early immunoglobulin response, band 23 and 39 are seen only in Lyme. If 1 out of 3 bands come back positive, let's say the 23 band, I could interpret that as an exposure to Lyme, even though the CDC may not call that a positive result, because that band is only seen in Lyme disease.
If you treat, and they were all a bunch of IgMs, it's only after treatment for, say, 3 weeks with, say, something like doxycycline, now you're getting IgM. Does that mean it wasn't treated properly, or it means it was treated properly?
As a result of treating with the antibiotic, you then break up the infection. The immune system then sees it and is able to make more of a response. So if you see more bands later on, it's a good indication that the body is responding to recognize the infection.
So if someone can interpret these tests correctly, sometimes at a proper treatment, you would observe them for a certain period of time?
For sure.
Now, is there a chance that sometimes you have Lyme disease and they don't show any positives?
Because the actual infection could be buried deep into lymph nodes where the immune system is not going to make antibodies unless the infection comes out of the lymph nodes. It could be deep in connective tissue areas. The antibody response may not be made because the person could be immunocompromised to some extent.
Sometimes would you use something that isn't an antibiotic in conjunction with the antibiotic to make, say, something like a chronic Lyme disease more apt to be treated?
Sometimes you can use more than one antibiotic. A different antibiotic can treat the cyst form of Lyme disease, which can be in a dormant stage.
What would be a typical antibiotic for that?
Flagyl.
Okay, and what would be one to treat the other way?
Doxycycline. Right. So using both of those, and I also use a proton pump inhibitor as well, such as Prevacid, Prilosec, Protonix, Sasifex, because that prevents the proton pump, which the infection needs to get out of the cell and to get into the blood. So between the two antibiotics, the doxycycline, you're covering whatever's in the blood. The Flagyl, you're covering the cyst forms. And with the proton pump inhibitor, you're stopping the infection from getting into the blood.
We know we use the proton pump with an antibiotic sometimes to treat certain infections of the stomach. Is that true?
H. pylori is treated the same way, and that's why in kids who I see who have Lyme disease that's greater than 1 year of duration, I treat them with 2 antibiotics and a proton pump inhibitor the same way we would treat H. pylori.
For how long a period?
2 weeks of antibiotics and 1 month of the proton pump inhibitor, the same as H. pylori.